The doctor is in this morning because we almost needed some emergency medical technicians for poor Alana over there who tasted the ghost pepper pizza. Your prognosis, will she be all right?
She'll be fine.
Okay, that's good. It's good that you're here. Good that you're here. However, a different kind of doctor. Dr. Lopez is a plastic surgeon, and we've been asking you on Facebook your questions because a lot of people have questions for a plastic surgeon. They're scared to ask them. They ask their friends. They end up with some crazy answers, and you can't get knowledgeable by doing that. So we posted some questions, and I've got some great viewer questions for you if you're ready. Gloria, we'll just jump right into it. Gloria wants to know, is plastic surgery getting more affordable?
You know, it is pretty much getting more affordable because there's more people doing it. So anytime you have competition, it's going to bring down the price. But really what's going to happen is there's more people across medical specialties that are doing it. So it makes it to where the patient needs to become more educated about the background of the people that are doing the procedures.
And by that you mean someone who maybe has been doing faces their entire life, all of a sudden is doing butt lifts or breast implants. And that's something that you want to make sure that they're good at doing, right?
You just want to make sure what's being performed on you is done by expert hands.
Okay, good to know. We've got a question from Sandy. Sandy says, what is the lifestyle lift? I'm scared of being cut. And she goes on to say that she's 68 years old, she wants to do something, but she's afraid of, you know, having surgery. But I see that lifestyle lift all over the place.
It's all over the place. So the lifestyle lift is actually it's a company and it's a procedure that this ENT in Michigan named David Kent started. And it is a surgical procedure. It is a standard facelift that does a standard facelift incision where they raise up the skin and they essentially will tighten the muscle. So they'll take the muscle and they'll bring it up and then they'll cut the extra skin away. So it is a surgical procedure, and they oftentimes will combine it with an upper eyelid lift, a lower eyelid lift, and then some liposuction of the neck. All of this is done without anesthesia. So what Dr. Kent has done, he's kind of found a market for people that want facial rejuvenation that can have maybe a lower cost. Going back to, is it more affordable? So then the question is it something that I would endorse? Well, it's really not fair for me to make that assumption, right? I'm a little bit biased. What I would say is for patients that are considering facial rejuvenation, they should do their homework, which means they need to meet with the surgeon. They have to get comfortable with the surgeon. If you don't have a good rapport with that surgeon initially, imagine after you've been cut on and after you've been operated on, you know, if you're intimidated by that, you're not going to be able to say, you know, your true feelings and whether your expectations were met. Secondly, you need to see before and after photos. It's kind of like saying, I want to listen to a jazz singer, so I'm going to buy a jazz singer's CD without ever listening to that jazz singer, right? So even though the lifestyle lift, for instance, is a surgical procedure, it's not something you buy off the shelf. It is something that's dependent on the expertise of that surgeon. And so you need to see the before and afters of that surgeon.
Do your research.
Right, do your research, absolutely.
Tamara wants to know what products or procedures are good to get rid of acne scars. So that's a real good question because a lot of people are dealing with that.
You know, having acne when you're younger and it kind of goes uncontrolled and you get these scarring that occurs. Unfortunately, a lot of that scarring occurs in the lower level of the skin called the reticular dermis. And that level does not really improve with the peels that we have to offer, with the lasers. So in general, what you're doing is trying to make all the surrounding tissue from that scar, from that pock, from the acne, to look better and kind of smooth it out. Ultimately, if you're not getting the improvement with the lasers, with the peels, with the Retin-A, with the skincare, ultimately what you can do is you can actually excise it. So remove that scar, because again, the reason you're seeing those scars is because it's at a lower level than the rest of the skin. Because you've damaged the skin lower, so you don't have that nice smoothness. So you can actually excise it. And now what you're trading is a depression for a fine line, which a fine line you can cover up with makeup.
It's easier to deal with. But and to start, I mean, if you're talking just little Retin-A is the way to go.
Skincare,
Skincare. Got a couple of things on the horizon. Some new Botox, well, a Botox competitor, I would say, coming out. We can look for that around San Antonio.
So Xeomin is the new one that just came out, and it is a competitor to Botox. Again, going back to is plastic surgery more affordable, competition causes prices to go down, right? So it's fantastic. Botox has been in the market, Botox has been in the market
for that to come down.
for greater than a decade. I've been doing Botox for 12 years.
Yeah.
Xeomin just came out in November this past year, and just a few practices in San Antonio have been offered to make it available to their patients.
Okay.
So I've been doing it since November. It's going to go out nationwide in March. And the studies that have been done show pretty much equivalency between Botox and Xeomin. Now, again, I have greater than 12 years experience with Botox, doing thousands of patients. I've got, less than 100 patients of Xeomin so far to go on. It seems initially that it seems like it's producing the results that patients want. And again, it's a lower cost option at this point.
Well, thank you for the answers.
Yeah.
I feel more knowledgeable, and I hope you do too. If you've got questions, you can contact Dr. Lopez. He's in the Stone Oak area. He's a board-certified plastic surgeon with Lopez Plastic Surgery. Go to lopezplasticsurgery.com or call the number that you see on your screen. It's 495-2367 for more details.